But our work is not done. In many ways, our work is just beginning. Ohio will not rise to its highest level until we do even more than we already have in several very important areas. And I want to talk to you about those. Let's begin by talking about mental health. Now, I'm very proud of the work that we've started together. And we've done a lot in the area of mental health in the last 3 years. For example, we've started the reform of Medicaid. Out of our really shared commitment to multi-system kids through a program that we're calling Ohio Rise. Under Ohio Rise, children who have multiple medical and behavioral health challenges will now get the help that they need and get it in their own communities. Parents will no longer be forced to give up custody in order to get their children the help they need, and families under Ohio Rise will stay together. We've also worked to create a landmark program to address the mental and physical needs of children right in their own school buildings. For 2 budgets, you've supported this. We specifically focus dollars for schools across Ohio to provide for on-site medical clinics, additional counselors, mental health services, prevention after school care, family support such as English classes, access to health care, as well as new training and programming around childhood trauma and mental health for our most vulnerable children. We're helping struggling families get better access to addiction and mental health treatment so that their children don't end up in foster care. And we have more than doubled medication-assisted drug treatment capacity across Ohio, and have dramatically increased crisis stabilization services. But despite our best efforts, it still is not enough. Mental illness remains on the rise in Ohio. Suicide is one of the top 10 causes of death for Ohioans aged 10 to 24, with the rate rising in rural Ohio and in communities of color. Accidental drug overdose deaths remain at record levels. The shared adversity of the COVID pandemic has worsened rates of depression, anxiety, addiction, and post-traumatic stress disorder. Access to care still remains elusive for far too many Ohioans. And over 40% of Ohio children have experienced one or more adverse childhood experiences, putting them at higher risk for lifelong health and mental health challenges. Now, to better understand how we got here, we have to go back in history a little bit. Let's go back 60 years to the Federal Community Mental Health Act of 1963, when hundreds of thousands of women and men with brain disorders were released from psychiatric hospitals, promised, as the then President John Kennedy said at the time, and I quote, they were promised that the cold mercy of custodial care would be replaced by the open warmth of community. Now, despite our good intentions, tragically, that promise was not kept, not nationally, nor here in Ohio. And that community system was never fully built. Ohio closed psychiatric hospitals, but without prevention or residential services in place, and without building full capacity outpatient care. Many Ohioans in need of support became homeless, languished in jail, or in prison. And now every day in Ohio we have families in crisis. They need immediate help. Immediate help. Too often they have nowhere to turn, no idea where to go. So the loved ones suffer, and sometimes these individuals, our friends, our family members, die needlessly. We can change this. While we can never fully remedy the mistakes of the past, we can resolve to change the course of history moving forward by making help visible, accessible, and effective in all communities of the state of Ohio. We can do this by investing significantly more resources in the following. 1, we must grow our behavioral health workforce. 2, by increasing research and innovation. 3, by building a community capacity for care that offers better crisis response services and treatment, increased prevention efforts, and more residential and outpatient services. Seated in the gallery today, next to the First Lady, is my longtime friend, Terry Russell, and his wife, Retta, and their son, Luke. Terry leads Ohio's chapter of the National Alliance on Mental Illness. I have met no stronger advocate for those suffering from mental illness and their families, the real heroes, as Terry calls them. After 50 years of dedicated work, he will be retiring later this year. And I know that Terry shares my goal for Ohio to lead the world in behavioral health research, community care, and workforce development. My friends, Ohio can be the model for the country and the world. The future Ohio that I envision has the best, most robust behavioral health workforce in the country. A workforce that is hailed as heroic and valued as a vital part of our whole healthcare system. I see an Ohio with expanded residential and community-based outpatient treatment options, so fewer of our fellow citizens need to be institutionalized or placed in long-term hospital care. I see an Ohio that catches and treats mental health problems and addiction at the earliest onset to lessen the chances of lifelong challenges. And I see an Ohio where families get support in their own communities as well as at school, so that teachers can teach kids, kids can learn, parents can worry less, because all kids in the classroom benefit when every child has the support to be physically and mentally healthy and the opportunity to live up to their God-given potential. I see an Ohio that harnesses the innovative potential of our great research colleges and universities to conduct strategic cutting-edge research. I see an Ohio with fewer emergency room visits and where fewer Ohioans with mental illness are living on the streets. I see an Ohio where mental illness isn't criminalized, lessening pressure on the criminal justice system. In the Ohio I see, fewer families face the unimaginable grief of losing a son, daughter, brother or sister, or a parent to suicide or to an overdose. I see an Ohio where shame, fear, stigma, and embarrassment are erased. I see an Ohio where mental illness is treated as a health issue, not as a crime. And those who seek health are met with respect and treated with the dignity that they deserve. Now, realizing this vision will require us to take a giant step forward. But if we build on our successes and the work we've started together, we can truly bring about lasting change. My friends, the system isn't broken. It was just never fully built. And it doesn't exist everywhere in Ohio. Yet. And so we must build it. We must do the work that has never been done before. We must fulfill the promises made over 60 years ago, but that were never kept. And the bottom line is this: Ohioans with untreated addiction, mental illness, will remain underemployed and unemployed, and so much potential for people, for families, for the state will be lost if we look the other way. In the weeks ahead, I will be coming to you with specific proposals for how we finish this important work. Now, it won't happen overnight, and it will take a major long-term commitment from all of us. We can create the opportunity for people with mental illness or addiction to build the skills to lead joyful, meaningful lives. And if we do, it will result in reduced community costs, more people working, more people contributing to the vitality of their own communities. And my friends, we have the ability. We have the talent. We simply must have the will.